On behalf of the Center for Patient Safety, welcome to NPRQI. I'm Kathy Weyer, the Executive Director of the Center, and in this video, I will explain the Patient Safety Organization protections for NPRQI data and activities and your role in maintaining those. If you have questions after you see this, please check the PSO information on the NPRQI website, including the FAQs, which will be updated periodically as we get additional questions from participants. If you still have questions, my contact information is on the website or on the last slide today. And as I mentioned, we are going to maintain a live list of FAQs as the project proceeds. What is a PSO? PSOs were made possible by the Patient Safety and Quality Improvement Act, or the PSQIA. Organizations like CPS became PSOs by meeting federal qualifications that were set out by the Agency for Healthcare Research and Quality, which is part of Health and Human Services. Their PSO listing and activities are voluntary. In other words, we do this because we want to. And all of the actions of PSO member organizations are voluntary. The PSO has no regulatory or compliance function. It exists simply to help healthcare providers understand and improve their safety picture while providing federal protections for the underlying data and analysis. PSOs also have an obligation to share important learnings from our work de-identified in order to protect the providers involved. The PSQIA has been in effect for more than 10 years, and the center has been a PSO since the beginning. And remember that the purpose of PSOs is to provide a safe haven for healthcare providers and their contractors to provide patient safety and quality healthcare work in a safe environment, and to provide an avenue for reporting patient safety issues to the PSO and their contractors, which can then use the information for learning and improvement. This is a very narrow scope of work for a PSO, and it's kind of an unusual setting, but we're very excited about doing it. So how do we fit in the NPRQI picture? The Center for Patient Safety has an agreement with the University of Texas, and UT has agreed to conduct the project in compliance with all provisions of the PSQIA. That includes having a secure process for the collection of data, secure storage of data and related work products, and to take appropriate efforts to protect confidentiality, only allowing access to the data to appropriate individuals from the participating organizations or their parents. And CPS and UT hope to be able to share information for the betterment of pediatric care, but we will only publish or share aggregated and de-identified information from the project. And CPS has collaborated on all developmental steps with UT to make sure that the provisions of the PSQIA have been met. Now, some of you may have other PSO relationships. That is not changed or altered in any way by your participation in this project. Our PSO work and their PSO work can exist side by side without any complications at all. If you have any questions about that, please contact us. So what does the PSO participation mean for participating organizations? It means that project data, once it's collected for submission, is patient safety work product. And I'm going to talk more about what that means later. But there is a point where you have gathered data in order to submit it where it becomes protected. It becomes patient safety work product. All data submitted to the project as part of the project is patient safety work product. So everything that you type into the portal and submit is patient safety work product. Information that you pull out of the system, the data that you pull out is also protected work product. And what can you do with this protected work product? Well, you can use it for any internal purpose in your organization. So you can use it at your safety and quality committee meetings. You can use it to deal with particular providers, but you cannot share it in that form outside of your organization. So for example, you can't pull your data that shows how you did on a metric and then pull the aggregated data from other providers that shows how they did on the metric, compare the two and put it in a commercial or an ad. Anything that involves taking any data from the system and moving it outside is prohibited because of the confidentiality provisions. I should also add here, when we say this information is protected, it is privileged. So it can't be requested by subpoena, it can't be brought into any lawsuits, and it also can't be requested by regulators. If you have any questions about what that means, please review the information on the website and then contact us. We will try to keep you up to date with what's on the website, but we always want to support you if you have a question about the privilege as it applies to any request for your information. And remember that the underlying medical records and business records from which you pull the data are not confidential, and they can't be under the terms of the law. You don't have to do anything else. So why do we have the PSO involved in this project? Well, NPRQI is a quality improvement and safety project focused on improved, safer care for pediatric patients, which falls squarely within the mission of PSOs. And we also know that state privilege and confidentiality protection for healthcare providers' safety and quality work is haphazard and it is spotty. And so as a national project, NPRQI wanted to make sure that throughout the country, no matter what state our participants were in, they would have uniform and complete confidentiality and privilege protection for the data that they prepare and that they submit. And again, we can share more information on the website, but the PSO creates strong, consistent protection for all participants, regardless of location, both for the data that they submit and any data that they receive back from the project as part of their participation. So I mentioned the term patient safety work product, or PSWP. What is that? There's a very technical definition in the law. I'm not going to repeat it here. It's available on the website, but it's the data that you've gathered in order to submit it to NPRQI. So information that you pull out of your medical records and your other records that you are going to submit. As soon as you pull it out for purposes of submission, it's protected, not the source material. Any data that you submit as soon as you have typed it in and submitted it to the project is protected. And there is a very secure technological pipeline for that. Your compiled information, in other words, what you have submitted and what the project has compiled on your behalf, and any de-identified data that you pull from the system that might represent data submitted by others, is patient safety work product. And additionally, you get protection for your deliberations and analysis surrounding the data you report. So as you discuss what you're going to report, or as you do internal work in your safety and quality functions on the data that you can pull back out of the system, that deliberations and analysis process is protected as well. So you can use the data safely within your organization without anyone being questioned about it or asking for records related to that use. How do you prepare your workforce for this? Well, you're going to have several staff members assigned to interact with your data and with the platform. And we have certain expectations of those individuals. Basic PSO education, which includes this video and the materials that we've supplied on the project website. You're going to need to digitally sign the confidentiality agreement, which is included in the registration process, simply to acknowledge that you know that this information is confidential and privileged. And you need to design reasonable processes to protect the PSWP within your own system. Now, for the most part, it's going to be protected within the NPRQI system and you won't have to worry about it. But for the information you may have gathered but haven't reported yet, or your collection of information that supports what you have reported, anything that you have, if it's on a digital system, you want to make sure that it's username and password protected with limited access. So you might want to, for example, have a SharePoint folder that's only accessible by individuals who are involved in this project. If you are using paper documents, we ask you to, for example, have a locked drawer or a storage room that's locked when no one is there. For the work that you do after you pull information back out of the system, or the discussions that you have and how those are represented, same thing. If you have any documents related to that, for example, meeting minutes or notes of discussions, use those same sorts of protections for those. And make sure that the individuals who are involved know that the discussions are privileged and confidential. If there is an unpermitted disclosure, for example, your systems are hacked or a disgruntled employee leaves and takes information with them, or simply shares it, let us know and we will work with you on next steps related to the unpermitted disclosure. Remember that once you've logged into the NPRQI, system, you are in a secure space. And the only time you need to worry about how you handle information is for your staging or how you treat the data that you've removed from the system. Thank you so much for participating in this program. If you have questions that aren't answered on the website or by this video, please contact us. We want to give you full information and support. And again, thank you for participating for the benefit of all of the pediatric patients.